COVID is transmitted by droplets. As we talk, there is a small amount of saliva that reaches out about 3 feet. If we cough, it reaches out about 6 feet. It can stay in the air for a few seconds, and then the virus can be deposited on different surfaces and can last on those surfaces for longer than that. So the idea of social distancing, or better, just physical distancing, keeping 6 feet apart, reduces the risk of those droplets touching one of us. Wiping down surfaces frequently will reduce the risk of transmission. We have to go back to the basics of medicine and public health and universal precautions. Having gloves on and thinking that we're safe, and then touching ourselves or touching surfaces with the gloves and then touching something else, that is just going to promote transmission. The operating word during this time is vigilance, not fear. Fear makes us make bad decisions. If we're vigilant, we won't touch our faces, we won't touch our noses, we won't touch our eyes. If we're vigilant, we won't shake hands, we won't bump fists. If we're vigilant, we won't lean on surfaces. And if we're vigilant, we will use our gloves for their intended purpose, which is to provide some protection while we do a procedure, and then we will take them off. As we do this, we will reduce the risk of transmission. When we're examining a patient, it is prudent to wash our hands before we go into the room, use all universal precautions, and while we're doing vital signs, while we're examining the lungs, asking the individual to turn his or her head to the right or to the left away from us, so that if they have to cough, we will not be touched by those droplets. That alone will go a long way towards reducing the risk of any transmissible disorder. If we have a person who we suspect may have COVID infection, but it's a low risk, using the same guidelines, but in addition, wearing gloves, wearing a mask, and it does not have to be an N95 mask, should give us sufficient protection. If it's a patient with diagnosed COVID and we need to examine them and we need to take care of these patients, then using all the protective equipment that we have available, gloves, gowns, masks, and face shields or goggles should be worn at all times while in the presence of the patient, and discarded in the order in which our videos in the intranet show. That will give us most of the protection. We have to remember that the majority of the people who get this COVID infection will experience a mild respiratory tract infection. We hear about the cases that break our hearts, but we got to remember that those are the minority, and that for the most part, if we follow basic guidelines, we will reduce the risk of exposing ourselves or exposing others if we are unwitting carriers of this virus. We have to take care of these patients. During the AIDS epidemic, hospices all throughout the country stepped up to the plate and took care of patients that everybody else was abandoning. We're not heroes. We're healthcare providers, and this is our job, and it's a great calling. And if we're careful, we will take care of these patients, make the quality of their life better, and live to take care of more patients tomorrow. Up until now, we've had several patients that are under investigation so far. Every single one of them has come back negative. No, those patients who we knew were positive were taken care of by appropriate hospital personnel who were donning the appropriate equipment under our guidance and supervision, and none of our staff were ever put at risk. And up until today, up until the time of this talk, not one of our employees has tested positive for the coronavirus. And thank you very much for everything that you do every day to make the rest of us look good.